Medical science is in the infancy stage of a new and highly promising technique to repair and regenerate damaged and missing tissues of the human body by using something called extracellular matrix, also known in the industry as scaffolding. As a Navy combat medic with 12 years of service with the Marine Corps Infantry, I have seen the worst of what the battlefield can do to the human body. While prosthetic limbs and severe scarring is all too common, the continued pursuit of regenerative medicine through extracellular matrix is no longer science fiction, but rather something that we are just developing. Here's a video clip of Dr. Alatala giving a speech at a TED convention about the process his lab is perfecting for creating flat tissue such as muscle to complex organ structures and blood vessels and hollow organs.
The strategy here is if a patient comes into us with a diseased or injured organ, you can take a very small piece of tissue from that organ, less than half the size of a postage stamp. You can then tease that tissue apart and look at its basic components, the patient's own cells. You take those cells out, grow and expand those cells outside the body in large quantities, and then we then use scaffolds, materials. To the naked eye, they look like a piece of your blouse or your shirt, but actually, these materials are fairly complex and they're designed to degrade once inside the body. It disintegrates a few months later. It's acting only as a cell delivery vehicle. It's bringing the cells into the body. It's allowing the cells to regenerate new tissue. And once the tissue is regenerated, the scaffold goes away. What about other structures? This is actually an engineered blood vessel. Very similar to what we just did, but a little bit more complex. Here we take a scaffold, and we basically, scaffold can be like a piece of paper here, and we can then tubularize the scaffold. And what we do is to make a blood vessel, same strategy. We take a blood vessel is made up of two different cell types.
As Dr. Atala discussed, using the extracellular matrix or scaffolding from a donor cells can be used as a microscopic skeleton for soft tissue and allow scientists to regrow complex structures from the patient's own body, thus completely eliminating problems with tissue rejection and the drugs associated with weakening the immune system. As a healthcare provider and medical professional that often deals with the aftermath of trauma, the use of rebuilding broken bodies from extracellular material is awe-inspiring. Take, for example, Marine Corporal Isaiah Hernandez. During a battle with the Taliban in Afghanistan in 2011, Corporal Hernandez lost 70% of his right thigh muscle, an injury that usually results in an above-the-knee amputation. He was told he would never walk unassisted again and was advised from numerous doctors that an eventual amputation was his only option. Corporal Hernandez first undertook a fitness regime to build up his existing muscle. Then surgeons cut open his thigh and inserted a slice of a substance known as extracellular matrix. After a few weeks, Corporal Hernandez found his leg rapidly growing in bulk and strength. While Corporal Hernandez still has significant scarring to his thigh, his leg is completely functional, and through EEG testing of the muscle in both legs, his injured thigh is stronger than his uninjured leg. Many biotech companies see the potential in using extracellular matrix for healing, and as such, there has been a significant push towards research and development of ECM products. With many companies jumping into this new technology, prices for the raw materials remain fairly inexpensive and widely available for use. With the advent of war and the ever risk of numerous diseases, mankind has always sought a way to heal the body. Over the last 100 years, many would agree that medical science has made huge discoveries and breakthroughs, leading to a better quality of life and prolonging the lifespan for many. With the use of extracellular matrix technology, regenerative medicine is no longer science fiction, but merely the next line of therapies for the diseased and injured. With continued focus, regenerative medicine could soon surpass all other treatments for many of mankind's most problematic medical conditions.